everyone, it's Jen here. Welcome to another episode of Weekly Hope. I am so glad that you are here and that you found us and that you're joining us and spending the next 25 or 30 minutes with us here on this show. Before I introduce our guests, as this is a weekly interview series, I want to let you know a little bit about what we do here at Eating with Hope and what this show is all about. Also give some people some time to sign on and find us. So eatingdisorderhope.com is an online mental health resource hub, and we are here to help provide you and your family with the resources that you might need, whatever place you are on the recovery journey, whether you're seeking more information, whether you're trying to find treatment, support for a loved one during the treatment and recovery process, or you're at a place where you're an advocate, you want to share your story, you want to read other people's stories, get inspiration from that, and looking forward to moving on to a place of total healing. So we're here for you with today's videos, blogs, articles, podcasts, all kinds of things are available on eatingdisorderhope.com. And we also have this show. So every week, usually, every once in a while, we'll take a break. We are here, and I'm able to bring on guests from all over the mental health and eating disorder field. And we talk with clinicians and experts, nutritionists, authors, advocates, people with their own recovery stories, authors, a wide range of people to talk about different topics. And every week we've got a different topic. And of course, we're always looking for new topics. So if you have an idea or something that you want to hear about, please let us know in the comments. Of course, you can always send us a message on social media or an email. Let us know what you want to hear about. But the really cool thing about this space here on Facebook Live is I'm going to bring our guests on in a minute. They're going to be here, and you have the opportunity to be a part of the conversation. So we would love for you to say hello, comments, let us know your name, where you're signing in from, to see where our guests are signing in from, and ask your questions at any time. It's one of the really interesting things is, we have PhD on today talking about movement and eating disorder recovery, like top expert in the field, and you have the opportunity to ask them your questions. Like, it's really incredible. It's an opportunity I wish sometimes I had in my own recovery process. So all that to say, we want you to be a part of this conversation, and we want you to drive it. So that's an invitation to you to not be shy and to pop in and get involved as we speak today. So we are very excited to welcome a really, really cool guy in the eating disorder field onto the show today. And I am going to bring him on screen here and introduce him. There he is. Hey, Brian.
Hey, how's it going?
It is going well. Very, very well. Brian is joining us today from California. So I don't think we've had a guest on yet you're signing in from the Bay Area, correct?
I guess not.
No, you're signing in from the Bay Area.
Oh yeah. I'm sorry. I thought you said we haven't. Yeah. Sorry, I couldn't hear you. Yeah, I'm in the Bay Area.
Okay, I was gonna say I don't think we've had a guest on from the Bay Area yet. So you're our first San Francisco guy to join us. So let me read a bit about you for a moment here for all of our guests, and then we will dive into our conversation. So Dr. Brian Cook is the Vice President of Movement Research and Outcomes at Alsana. He is a sought-after expert on eating disorders and associated psychiatric illnesses. Brian has collaborated with other Alsana professionals to develop an innovative movement program designed to change the client's relationship with exercise from a compensatory behavior to one that functions equally with other components of complete health. So that's exactly what we want to dive into today. So first of all, Brian, can I call you Brian or should I call you Dr. Cook?
Brian is fine.
Okay. So Brian, first of all, tell us a little bit about what you do at Alsana and also where Alsana treatment centers are located in the United States.
Sure. So Alsana is a nationwide treatment facility. We have programs all over the country. Here in California, we have residential partial hospitalization and intensive outpatient in Monterey, in Santa Barbara, and also in Westlake, which is right near LA. We also have the same level of care in St. Louis and in Birmingham, Alabama, and we also have an adolescent program in Birmingham, Alabama. So we cover everything, kind of not necessarily everywhere, but at least across the country. And we do have clients from all over the country and even all over the world come to Alsana. I know we had a client here in California from New Zealand. So people do come from wherever they are, wherever they need to be.
That's wonderful. And tell us a little bit specifically about your role.
Sure. So with my role, it's kind of a double-edged role. I obviously do some of the research and outcomes, as you mentioned. And I do think that that is something that needs to get more involved with clinical work, because ultimately research isn't about, tinkering with numbers and, playing with beakers in a lab or anything like that. It really is about accurately assessing and measuring and understanding what a client's going through. It really reflects an evidence-based approach, and that's something that we're big on at Alsana, is to make sure that what we're doing is backed by evidence, backed by data. So what we try to do is translate what the research and the evidence says is the most effective way of treating an eating disorder and put it into practice, and that's obviously a very difficult thing. That's really what I do with the movement component of our work. When you look at the history of how we've treated exercise in eating disorders, it's really kind of an interesting history, really starting with the kind of shock and awe of looking at a very emaciated person with anorexia that over-exercises and just being like, wow, all right, what's up with that? And kind of allowing that to inform treatment practices. In the last 15 or 20 years or so, we've learned a lot more about the nuance of exercise and how we can actually intervene on that. So we take a lot of that new knowledge, that kind of cutting edge approach that researchers around the world and clinicians around the world are developing, and we implement it into our treatment modalities at Alsana. So our approach is really much more comprehensive and all evidence-based, like I said, to try to get the full scope of eating disorders. And I think obviously exercise is a major component of eating disorders that often is just kind of pushed aside for a variety of different reasons. But we embrace it, and it's a challenge, and we like to help our clients where they're at. I think it's a very client-centered approach to be able to say, well, we know that you struggle with exercise, and if we just tell you not to do it, you're going to do it anyway. So let's try to work with you and figure out a way to make this work, and you're not going to hurt yourself.
It's so good. It has been pushed aside for many years and for a lot of different reasons. Why do you think that that is?
I think a lot of it is the fear. I know I've talked to many clinicians about it. A lot of it is the fear that, let's face it, if you are emaciated, if you are medically compromised, nutritionally compromised, exercise is a major physiological load on the body that can have some incredibly detrimental outcomes, including death. And nobody wants that. We all want to help our clients. We all want to have benefit, not harm. So on a very superficial level, it's just easier to say no. Unfortunately, we know that's not human experience and human reality. If you tell somebody no, they're going to go do it anyway. Also, if you don't teach them how to do it, they can go down some pretty nefarious paths. And we see that a lot. I think even aside from eating disorders, we all struggle with that. We all are constantly bombarded with these ridiculously pathological and maladaptive messages about exercise. That exercise affects our body and our shape and our size and our appearance. And then you throw food into the mix and diet plans and this and that and the other thing, and it's just enough to make you, make your head spin. You throw an eating disorder on top of that and forget it, all bets are off. So I think because of that, exercise is a very complicated and complex issue, especially in eating disorders, let alone in regular society. Quite frankly, there's not many people in the eating disorder world that have been trained on the specifics of that complexity. So lucky enough at Alsana to have people that do that and have that training. Obviously, that's a big part of what I do. And I know other groups around the world are doing that work as well. So I think if we come together with that, we can really help advance client care and really help people that are struggling with this. So that's a big thing that we try to bring to the table at Alsana.
Yeah, and first of all, it's interesting because most people actually, it's a big misconception and myth that people that struggle with eating disorders all look emaciated, which is actually not the case at all.
Right.
And you can't tell someone's internal health too by how they look. There are, and I've had many clinicians tell me that, there have been sadly people who have passed away or suffered serious health complications due to their eating disorder at a normal or in a larger body, right? At a normal size or in a larger body. So we can never discuss health as a function of someone's size. So,
Absolutely. I completely agree. I think that's a perfect way to put it.
you know, so important to mention. And then the other thing is, it seems so right that you would learn how to heal a relationship with movement and exercise during the recovery process in the same way that you heal a disordered relationship with food, right?
Exactly. And that's just it. I mean, you can't just say, all right, well, you had a disordered relationship with food, therefore never eat again, right? I mean, that doesn't make sense. But yet we
Yeah.
do movement and we have to move. Our bodies are built to move. When our body moves, it functions efficiently. It actually heals itself. It has way more benefit than it does in the alternative, which is to be sedentary and to say,
Yeah.
don't move. Also, societally, I mean, what do we do with somebody if they've gone through treatment and they're, quote unquote, recovered? But their friend calls them the next weekend and says, hey, let's go for a hike. Are they supposed to say, I'd love to, but I can't, I'm in recovery? I mean, that's not full recovery. That's not a holistic approach to well-being, socially, physically, mentally, and otherwise. If you do that, it's just going to trigger all of the other things that we know relate to relapse. So I think what we have to do is find ways to work with the person and just be honest about the human condition and the human body and the human mind and that mind-body connection, and say, all right, if this relationship is not working, how do we get it back to being a functional relationship? How do we get all of those different things that we need out of movement without experiencing all of those other kind of detrimental responses that we get, obviously, in eating disorders? So what we really try to do is teach the clients that we have to work with their body, not against it, to try to understand what their body's telling them, to try to listen to those cues, pay attention to those cues, and try to encourage the body to do what the body is built to do, what it naturally wants to do, not to try to control the body. And I think that's a real key distinction when you start looking at that. It really fits into the whole eating disorder mentality, I think, and maybe kind of ironically by telling clients or people with eating disorders to not exercise under this auspice of safety, we're really doing a lot of detrimental harm to them because it's not really the way the body's built to be. Kind of one of the ironies, I think, of mental health care.
Yeah, absolutely. Great points. Jeannie says here, I've had bulimia for 8 years. I was never really taken seriously because my weight was considered normal. So I can relate to that.
Absolutely.
And Alexandria says, what does disordered eating look like? And I know your piece is more the movement piece, but do you have any way that you can illuminate that term a little bit more for Alexandria?
Yeah, I think a lot of it is, I mean, with any behavior, really, we have these beliefs about what a behavior is supposed to do for us. We see that all the time now with diets. I mean, everybody has the best diet, and I hate that word, the best. I mean, there is no best. All of these different fad ways of eating, these different monikers and diet plans and things like that, they don't necessarily respect human physiology. I mean, at the end of the day, no matter what food you put into your body's going to do with it what it's built to do physiologically, biologically, and chemically. So I think what we have to do is respect the fact that we need a full array of different types of foods and different types of nutrients. And any diet that encourages you to load up more or less on one nutrient or one type of food than another probably is missing the point. I used to teach nutrition classes when I was a professor, and I tell my students all the time, there's really no such thing as good foods and bad foods. There's really just good behavior around food. And that's really the key right there. So I think what disordered eating looks like is really when we kind of fall prey to a lot of those messages and misleading claims about what a diet can do for you or what the outcome about that diet's going to be. Ultimately, humans are just physiological animals. We have a certain way that our body works and a certain way that it needs to be fueled. If I gave everybody a fancy sports car, you wouldn't put the cheapest gas that you could in it. You'd put the good stuff in it to make it run well. Yeah, do the same thing with our body. We put the cheap gas in it and then wonder why it's not running well. So we really have to kind of look at ourselves and say, all right, what's my body telling me? And that type of awareness is really a difficult thing. It's a practice that we have to work on constantly. But ultimately, humans have been around for a while. These fad diets come and go.
Yeah. We're getting lots of questions here. This is so cool. And I see Becca is here. Hey, Becca, so good to see you. And she joins us, and she's got a really great question about athletes. And I want to, Becca, if you just hang on one second, and because we're going to talk about this specifically. So great question. And I'm going to pose it to Dr. Cook Brian here in just a few minutes. So just hold on with me. It's a great question I want to get to. So hold on, we got all these great thanks, guys, for chiming in. This is so great. I just want to just make sure that we get all these. Yeah, this is Amy. This is just a good perspective. I wanted to hear from Amy. She says, I was diagnosed with anorexia, and she's obviously struggling with weight gain. And my doctor keeps telling me about my weight, but I get a panic attack when everyone says I don't have an eating disorder because I'm not showing bones. Yeah, and Amy, thanks for sharing your heart on that. And it is something that I think we need to educate the public about more.
Absolutely.
And all of us can be little educators in our own spheres of influence, to say, eating disorders are about so much more than what you look like. It's really here and in your emotions. So, all right. So obviously this is a topic that people really resonate with. So I'm really glad that you're here and that we're talking about it. Just a quick, how big is this problem question? How often people who come into treatment for an eating disorder also have a very disordered relationship with movement?
Yeah, that's a great question. So obviously I work in a treatment center, facilities around the country. So with eating disorder treatment, you tend to get people that have been to treatment before. And at least here in America, a lot of our approach to exercise is to tell clients to never exercise again. So one of the curious things that I've been noticing is a lot of clients that come in and say, oh, well, I just don't exercise anymore because I used to, and I'm scared that it would become a problem again. And I think that's equally as pathological because of what I said a second ago. Our bodies are built to move, and we know that if you can fuel your body properly, exercise really is that straw that stirs the drink to use all of that fuel and that nutrient to help build your body and keep it functioning optimally. So if you're not doing that, and we have the data on this, and ironically, we know from large-scale population studies that exercise, if you don't do it, if you're sedentary, it can actually increase the risk for a lot of the things that we know are triggers for relapse and eating disorders, like depression and anxiety and emotional difficulties and stress response and things like that. So we do see a lot of that. Obviously, we see a lot of clients that struggle with exercise actively as well. Exercise is often turned to as a way to deal with a variety of different things, whether that's shape concerns, weight concerns, emotional regulation, just kind of externally regulated rules of I have to do this because that's what I am. Getting into this idea of your own belief about yourself, like, no, I am an athlete, or I am an exerciser, or going to the gym is part of my identity, or running that triathlon is something that I have to do socially, and therefore I have to meet a certain criteria with movement. So a lot of these messages get convoluted, and it speaks to the complexity about exercise and how exercise really does infiltrate all areas of life and of the human being. So we try to kind of work with that. So even though I know I'm probably not giving an exact percentage answer, but
we don't need numbers. We don't need numbers.
Cool. I think it does affect everybody because certainly, we're all human. We're all working with the same hardware, and we need to move. If we move, our bodies respond accordingly. So I'd probably argue that even people, for example, with binge eating disorder that are completely sedentary, that don't want to exercise or anything like that, we know, and we have good solid evidence with that actually, that if we can get people moving even just a little bit and challenging what this idea about exercise is, and that's another main point that I want to make, is when I say the word exercise, I don't mean the exhaustive sweating, huffing and puffing. It just really means working with your body with a good intention to help your body. So that can be something like walking. It can be something low intensity. Even with people that don't exercise or don't have an issue with exercise, we know that if they can do even that, just go for walks and be mindful and aware of the connection that they have with other people, with nature, with even just literally stopping to smell the flowers, actually helps with their recovery, and it helps prevent relapse or contribute to a lower risk of relapse is probably a better way to say that. So I think it really just speaks to the kind of static nature that the human body is built to move, and when it does, it functions much more efficiently.
Yeah, no, it's so good. I love that you said stop and smell the flowers, because I think about that. Like, I do it all the time.
Absolutely.
But that exercise doesn't have to be this like intense cardiovascular or even going to the gym. And I think that is also a big barrier sometimes for people if they're self-conscious about their body, whether they feel that it doesn't meet society's norms in either direction, right? They either feel like they look too thick or they feel like they're in too large of a body.
Totally. Yeah, and I mean, first off, with that type of comparison, you have no idea what that other person's going through, what their genetics are, what their experience is, what supplements or drugs or whatever they could be on, and that's certainly pervasive in gym culture. And I'm definitely not endorsing any of it, but you have no idea where they're at. We're all just doing the best we can with what we have, and I think the best thing that we can do with that is to learn how to work with our bodies and work within our environment. I'm not a big gym person. I mean, I've been to gyms and stuff, obviously, but I much prefer to go out, go surf, go for a hike, go paddleboard, go for a run, just connect with nature, you know, anything like that. I get much more out of that. You get more immersed in the moment. You get more appreciative, more connected. It's just more fun. And that's really the key with it all is I think going out and going, you know, swimming in the ocean or in a lake or in a river is more fun than swimming in a pool. And nothing against swimming in a pool. I love it. I do it all the time. But I think there's just something about that connection with nature and that connection with other people. So I don't think we have to have it where we're so kind of focused on, all right, this is the gym, this is the program, this is the workout, this is the, you know, what somebody else tells me to do. I think we need to figure out what we want to do and internalize that. I often tell everyone, clients or friends or staff or whoever, you know, think about little kids. They just do things because it's fun and they want to do it. They've got it figured out. They don't go to the gym because they have to and they're told they have to do a certain prescriptive workout every single day. They do it because if it's not fun, why do it, right? And that's what I think we need to do is that's a way that we can start to work with our body and learn what our body's trying to tell us, learn where that response is, learn where that, you know, signal is, and enjoy it. Just enjoy the moment.
Yeah, I love that. We've got two great questions here. One is from Amy, and Amy says, should movement be a part of treatment for people who don't move due to chronic pain?
Yeah, chronic pain is a real interesting one. It's something that I remember back in grad school, I was really interested in. I did some research on it and subsequently talked to other researchers about this issue of pain because we know people with eating disorders have a lot of chronic pain. And that pain response is kind of all over the place, depending on an individual. So I can't really tell you anything about that. All I can say is exercise, we do know, works on so many levels on the body. It's not just your muscles or just the blood flow. We know now more from the exercise physiology world about the different biochemical responses to exercise, what your cells are actually doing and how they're functioning. And we know one of the things that goes along with that over time is a pain reduction. So I think it's important to differentiate pain from injury and work with a credentialed licensed professional who understands how to move the body in a way that over time can actually reduce pain. And we do have a lot of work being done in that area and a lot of clinical professionals that specialize in the use of exercise with that. So without knowing the specifics of your condition, Amy, it's really hard to give a specific, you know, a piece of advice about, oh, well, just do this workout or just do this exercise or whatever. But the encouraging thing that I want to leave you with is that we do know more about the science of pain management and the physiology of it and how exercise affects that physiology and over time can reduce it. It's one of the things that I often cite as a reason that we need to focus more on exercise and eating disorders. If you just go back to even the 80s and 90s, people used to say, well, if you have arthritis, never exercise because, that's painful and there's already inflammation and damage and everything there. And actually, we know now that if you exercise, even with arthritis, it helps reduce the pain, it reduces the inflammation, it reduces all of that response. So there is some solid physiological evidence on the cellular level of why that would actually be the case. And I don't want to geek out with, kind of specifics here, but there are people that can help with that.
So cool. Thank you so much. Quickly, I just want to address Jeannie's question because it's an easy answer. Jeannie said it's kind of unrelated, but how likely is it that a child will develop a mental disorder or eating disorder by witnessing their parent or parents doing it? And I would say highly likely. I think very, very likely. So yeah, and the parent-child and the family relationship is something that definitely needs to be explored in therapy with the help of professional clinicians. And so yeah, I would say you're on the right track with that one. And then I want to get to this question, and this is a really good one from Becca. Becca says, Dr. Cook, thank you for being here. In treating elite athletes who are survivors of sexual abuse by their coach, what things can you suggest for the patient who has now rejected all physical activity? I understand that PTSD is a part as can be very triggering for them. Are there strategies that you suggest to encourage movement in this group?
Yeah, that's a tough one because there's so many different things going on with that. Unfortunately, coaches can be really, really good, but they can be really, really bad as well, especially when there's issues of trauma and abuse and disrespect that way. Obviously, I would encourage getting out of that situation. But I would say finding a way to use movement as a way for self-sufficiency and building that trust. Obviously, a lot of movement can be about cooperation, can be about working with other people as well as working with yourself. And that can be very therapeutic. What really got me into this was about 20 years ago, working in a group home setting and taking kids from the inner city who had never left the city. A lot of them had abuse and trust issues. In fact, one of the houses that I worked in was for sexual abuse survivors, and taking them out of that inner city environment out to the mountains. And this is back in New England when I lived there, and putting them in a different place where they had to work together and build those connections and be in a place where everything isn't so structured and kind of built around what they have kind of created, and learning ways for self-sufficiency and working with their body, obviously to, in this case, just climb a small little mountain and things like that, finding that cooperation, digging into places that they didn't really know that they had, seeing and learning new things about themselves. So I think it is possible. It's a long, slow haul. Obviously, there's going to be a lot of progression and regression with that. I think that's another misconception about exercise, that if some is good, more is better. If you just do it, everything will be fine. And that's not the case. I mean, everything is a dance. It's a couple steps forward and a few steps back, maybe a few to the side, twirl around a little bit, and then you can keep going. So I think over time we can do this, but by working with the client, working with whatever that need is, and getting back to the pure pleasure of movement, because obviously athletes have at one point, at least to begin their athletic career, that pleasure in movement. We can find new ways of doing it. And maybe the old sport with that coach who was abusive and traumatic, maybe that's not something that we can do, but there's a whole variety of other things that we can do to introduce that idea of self-sufficiency and cooperation and working with our body and all of those other aspects, those benefits. And I could go on and on about benefits of exercise. So I would say, try to meet them where they're at to find different ways to enhance those other things.
That's so good. And thanks for answering that, because that is a really tough subject. And kind of jumping then to the athlete's perspective. There are certain sports in certain areas where eating disordered behavior is more common. And actually, just I was recently with someone who mentioned that in the community of people who do professional ski jumping, like, in the Olympics, when you go down they sail off, that there's actually a very big problem with eating disorders in that community, which I
I believe it. Yeah.
Could have imagined. But obviously, these are people who are driven by passion. I was a ballet dancer, and while I don't consider myself an Olympic athlete, it is very intense physically.
Absolutely.
And so now for me personally, I realized at that point in my life I had to remove myself from the pressure of pursuing a ballet career. Like I still danced, and then I pursued musical theater so that I could sing and dance and do other things and not just be a ballet dancer. So I had to shift my identity a bit. And I had to remove myself from that very competitive, toxic environment. It was good for me. In working with competitive athletes who love their sport so much, can they fully recover and continue to do their sport? What's your view on that?
I'm pretty optimistic. I think you can. I can also speak to that because I was an athlete, and I mean I ran cross country and played tennis in college, and it's really how I got interested in all of this. Is that I'd go to practice, listen to what my coach was saying, listen to what my teammates were saying, listen to what other people were saying, and how that's supposed to help me be a better athlete, especially a runner. And then I would go to my psychology classes in college and learn how all of those same things mean you have mental illness, and you can't have it both ways. It just doesn't make sense. So
Hilarious. Yeah.
that's really where I come from with this. Unfortunately, it really messes you up. It really confuses you. And it really does change that relationship with movement, with exercise, with, for me, running, for anything like that. The competitiveness aspect of it is a big part of it. So I think what we have to do is recognize that as an athlete, we're really in touch with our body. We really know how to use our body as a tool to get a job done, whatever sport that is, whatever endeavor it is, especially ballet. I mean, you're out there and you're self-sufficient. How do we maximize that? How do we get the best performance that we can out of ourselves? It's really the key common thread to all athletes. And ultimately, what we know with that is by training properly, by fueling properly, and most importantly, by resting properly, allowing the body time to recover and regenerate and rebuild and literally come back stronger. We can actually get the job done on the field or the course or the court or wherever it is that we're playing the stage, I guess, if it's a ballet. We can get that performance better. And that's really what we want to strive for. When we look at an eating disorder, it may be telling an athlete one thing about, oh, don't worry, I'll help you with the performance. And it actually might even be really good at conning you into that. For example, with my sport, running, if you lose weight, yeah, you can run a little bit quicker. You're moving less mass over time and space. But you're also taking away muscle mass. You're taking away strength. You're taking away the fuel source for energy in your body, which is glycogen, and that's stored in your muscles. Over time, this catches up. Over time, you're going to start running slower. And that time usually happens a lot quicker, a lot sooner rather than later. So the eating disorder can be very nefarious with an athlete because initially it may actually serve a purpose. And then we think, oh, well, see, it worked once. Therefore, if I just do it more, it'll help again. And it never does. It's very addictive that way. This is why we look at this in terms of exercise addiction and dependency and things like that. But I think what we have to do is take ownership of our body and not let that eating disorder dictate what we do, because we know our bodies the best, especially athletes. We're very in tune with that biofeedback and that functionality of our body. We know, we may not always acknowledge, but we know when things are a little bit off in our body, whether that means an injury, soreness, nutritional aspects, mental aspects, anything like that. And it's our job as athletes to coach ourselves to be able to come together and say, how do I be the best that I can be? And I'm paraphrasing a little bit of a John Wooden quote, we're not all equal when we go out there. We're all different heights and shapes and strengths and all of that, but we are equal in our opportunity and our ability to perform at the best that we can. And if you perform at your best, you can find some real personal satisfaction in that. If you take it away from just simply beating the other person, but to doing the best that you can do, that's the real soul-filling aspect of movement, of exercise, of being an athlete that we all should be striving for, not the external accolades of, oh, you're great because you beat somebody else. Again, there's so many external things that you have no idea what are at play with that. But at the end of the day, you can put your pillow on the head, you put your head on the pillow at the end of the day, knowing that you went out there and did the best that you could and worked with your body to actually perform in a way that was efficient and maximized. And that's really the key. And an eating disorder is really, really cunning about taking that away from us over time.
Yeah, so good. Preach. I want to say to Jeannie, I'm going to stick around and I'll answer your question at the end once we say goodbye to Brian. It's a good one. And it's specifically related to something I've dealt with. So I'll get to this other one for Brian, Becca, because this is super good. Becca says, I've had eating disorder patients say they're struggling during movement therapy with their accelerated heart rate, that it's triggering for them to participate in movement therapy. Are there tips working with these women, helping them get back their ability to have an accelerated heart rate and become okay with that feeling?
Yeah, it's an excellent question. That's something I've experienced as well. Just as an anecdote, I remember one of the first things that I did, even back in grad school with movement and exercise, we had a person who didn't understand that when you exercise, your heart rate does go like that, and it was triggering. And she actually ended up almost having a panic attack, thinking she was having a heart attack. I think the key with understanding that is the understanding. When we look at movement therapy, it's not just about the behavior. It's about all of the other factors that go into the behavior, because certainly when you look at the behavior, if that were the case, then again, you can't have it both ways, where the exercise causes the eating disorder or contributes to the eating disorder, but it can also contribute or cause, health benefits and recovery and things like that. Same thing's happening here. When we have this idea about the heart rate accelerating, that's just a simple physiological response. You're activating the sympathetic division of the nervous system. The body needs more physiological resources. One of the ways that it does that is it increases the heart rate to get all of that out to the rest of the body. The mind isn't on board with that, though. The mind interprets that as, what's going on? Oh no, this is bad. Why is my heart racing? When I get anxious, my heart races, so therefore I must be anxious. And all of these other things start really, spinning around in a blender in your own head. So I think the important thing to do with that is to educate, is to understand a natural, normal, physiological response to movement. Learning how to listen to the body, that biofeedback that I've talked about a little bit already today, learning how to understand what it feels like to be doing that. And I think with eating disorders, we need to stay in those moments a little bit longer and truly appreciate it. It really is about the mindfulness aspect of it. I mean, this is one of the things that makes yoga so popular for eating disorders now, where even 10 or 15 years ago, that wasn't the case. But true good yoga practice is about the mindfulness. It's about the intention, the gratitude, the connection. It's not about the actual movement. The movement's great and the poses help encourage all of that. But without that mindfulness component, without that understanding and that appreciation of how the body's working, you're not going to get to where you want to be. And if you only look at the heart rate going up and panic about that, you're not really appreciating what the body does. So I think having a little bit more education and guidance and support around normal physiological responses and how that works is really a good way to start to appease those fears.
So good. Okay, so I've just got a couple more questions for you.
Sure.
And so just want to say, if anyone's got any last minute things, pop in there in the comments. And Jeannie, again, I'll answer your question at the very end. So what do you say to people who say they hate exercise?
Yeah, that's funny, because I was that person for a little while, especially after, I was done running in college. I would say you probably have had something that has changed that relationship, especially if you once liked exercise or loved exercise. If you never liked it, maybe it is about your belief about what exercise is. We talked about that a little bit a few minutes ago, where, this notion of no pain, no gain, that's one of the worst monikers ever.
Like I've eaten that, or
right.
I'm making up for something, or I need to punish myself.
Exactly. All of these conceptions and myths that we have about exercise could be contributing to that. I think everybody can find something that they appreciate, whether that's, it could be, like I said, yoga, a walk, a sport, an activity, a hike, anything. Finding ways to just kind of connect with ourselves and with others and with nature and with the kind of larger being. Sound like Yoda and say connect with the force. But anything like that, I think we can find ways to work with ourselves. If you once had that and now that's gone, try to trace back what changed with that. What was that moment where that changed? Was it about the eating disorder? Was it about a traumatic experience like a coach that you mentioned earlier? Was it about an injury? Was it about anything? All of these things. Maybe look at, am I properly fueled? Because a lot of times what happens is that we're not properly fueled to go out and do an activity. and our body responds accordingly, and it hurts. It's not fun. So we go, see, I knew I didn't like this. But if you are properly fueled and you can enjoy it, you give your body the fuel that it needs to be able to function in the way that it's intending to and get through the task that you're asking it to do, then you can really change that relationship, I think.
Yeah, I love that. Last question, Brian. Sure. If someone is watching this and they're really in a difficult place in their recovery right now, and let's say, you know, they also really struggle with their relationship with exercise, what would you say to them?
Yeah, it's a tough one, obviously, because especially with exercise, there's so many mixed messages out there. I would say, know that you're not alone, that this is way more common than what a lot of people, especially clinicians, say. Just because we have this kind of status quo of, well, just don't exercise then, we know that that doesn't work. We know saying don't do it just creates forbidden fruit, and it further exacerbates all of those unpleasant feelings and emotions that we have in general. I would say try to really reflect on your own self, listen to what your body is trying to tell you, have that conversation, get that connection back. That's something that we don't want to do. I understand it's really hard to get that connection back with the body, but I think that discomfort and that dislike of exercise is really your body saying something to you. And if we can have that open and honest conversation, I think honesty is a big part of this as well. Being honest with ourselves, being honest with what we're doing and who we are and who's influencing why we believe what we believe, being honest about what we believe, being honest about why we believe either exercising or not exercising will lead to whatever outcome we want it to. And really just kind of bringing that in line with reality, with a rational understanding of how the body's built to work, and really just trying to pick it apart and figuring out all of it. It's a tough thing, but you're definitely not alone. We all struggle with it, with an eating disorder, without an eating disorder. This isn't going away, and I think society is just making messages about the role of exercise, the role of nutrition with exercise, with body, with shape, with the way we express ourselves, with all of that. It's just completely convoluted. So know that, you know, everybody else out there, they don't know you. You know what your body's going through, and you can listen to it. So don't try to rely on somebody else to fix the problem for you or to give you that workout that's going to do everything that they promise under the sun. You want to be able to kind of understand that yourself and get that kind of introspective awareness and connection with yourself to really kind of get through this.
I love that. Thank you so much. So many wise words you shared. I could talk with you forever. This is so.
Yeah, this is great. Thank you.
But yeah, so we'll say goodbye. Thank you so much, Brian, for your time. We really, really appreciate having you on the show. Thank you so much.
Thank you for having me. This was great. And thank you everyone to the great questions.
Yeah, totally. Cool. So bye, Brian.
Bye.
And I just I want to answer Jeannie's question, and I also just want to add to that. I mean, there's so many brilliant pieces of wisdom that Brian had to offer, but also just that in the same way that eating foods doesn't make you good or bad, doing exercise or not doing exercise, or what kind of exercise you do, doesn't make you a good or a bad person. Just want all of you out there to know, if you work out every single day, it doesn't make you a good person. What makes you a good person is that you're a loving, kind, compassionate individual, and so many other qualities and characteristics about who your soul is. I think our culture tries to tell us that if we work out every day and we eat all the right, perfect, pure foods, that we're a good person. But being a good person is a lot harder than that. Takes a lot of soul work. And so I just want to encourage all of you out there that are thinking of going in that direction to make yourself a person worthwhile. Who you are as a person is inside. It's not about changing your body shape or size or how much you exercise. And then I just want to answer Jeannie's question. So Jeannie, you said about competing in pageants. And I just wanted to speak to that specifically because I have had that experience, obviously. Do you think beauty contests have a great deal in dealing with developing an eating disorder? I found myself being extremely obsessed with exercising in preparation for pageants. And then she said, I've given up competing, but sometimes I feel it lingers in my recovery. I've witnessed so much with the other contestants at times it can be triggering. Do you think I should continue competing? It's something I love. However, I tend to get triggered and start to compare myself. So Jeannie, I just want to say thank you so much for sharing this. Obviously, I'm not in your head, so I can't know how powerful those triggers are, or how powerful that comparing is. Because let's face it, someone can be in recovery and recovered for the rest of their life, and also have times where that voice or comes up and you compare yourself to someone else or you get triggered, right? That's just a part of life, and it's how you act on that, right? So I don't know. I can't tell you to yes, stay competing or no, don't completely, because I don't know you personally. But my first reaction would be that if you don't feel like it's a healthy environment for you, to not go there. And also, I would say which part of you, your healthy self or the eating disorder self, which part of you really likes competing in pageants? Because it can be the healthy self, like you really enjoy, the process and being on stage and performing, perhaps, or it could be the not so healthy self that enjoys the getting in like the right pageant shape or something like that, or enjoys being compared to other women and winning. So I think that kind of piggybacking on exactly what Brian was saying is like it's really important to do that internal assessment and go, what are my motivations? Why am I doing this? Why do you really like it? I would challenge you. But first and most important is your health, the health of your body and the health of your mind. So if you do it on say, I cannot do this and be healthy, do not do it. There are so many better, wonderful things out there. Obviously, there can be good things about it, but if you don't feel healthy, you can't do it. The most important thing is to take care of you, and everything else is secondary. So thank you for sharing your heart. And if you want to talk anymore, send us a direct message on social media, and I'd be happy to chat with you more. So, okay. That was, thanks for sticking there with us, guys. This is a long one today, but so good. So please feel free to share this episode with your friends. It's going to be here on our Facebook page as well as on our YouTube channel, YouTube channel. So feel free to share this with someone who you think it might be helpful for. We just want this information to get out there and people to get the help that they need. So thank you for watching, and we will be back. I just got to make sure we will be back next time. Stay tuned to our social media to see our guest topic will be. And hopefully you enjoy another episode of Weekly Hope. So have a great, wonderful, blessed day wherever you are.